Welcome to this Optical Awareness training video for care staff professionals. As the largest provider of domiciliary eye care in the UK, we've designed this video to provide you with useful information about the eyes and the eye problems that may be experienced by residents in your care, to give you a better understanding of how best to assist them. This training video is intended to be viewed in conjunction with the Health Call Optical Services Training Manual and the set of eye disease simulators that we've supplied with this video. When our eyesight is good, we take for granted the colours and textures of the things around us, the expressions on people's faces, the pictures on the TV, and the print in letters, cards, or in the morning newspaper. And food on your plate looks enticing and appetizing. And we take for granted that we can judge distances and avoid everyday hazards such as low-level obstacles in our path. But what when you're elderly and your vision is impaired, and colourful objects are just a blur? Or you can't see or read the expressions on people's faces? And there's no enjoyment in looking at fuzzy images on the TV, and print and pictures are permanently hidden in a mist. And the food on your plate is just a bland, unappetizing mass. And open spaces can be daunting, dangerous places. Casually placed obstacles can so easily lead to falls and fractures.
Oh, Eric, how have you managed that? Are you okay?
Did you know that poor sight is strongly related to falls in the elderly, and that over 189,000 falls occur each year in the UK as a result of visual impairment? 60% of care home residents will fall at least once a year, half of whom fall repeatedly. So it's recommended that when older people undergo a falls assessment, they should also have a full eye examination by an optometrist. In many cases, the cause of seriously blurred vision is simply the need for correct spectacles. Older people's eyes can alter more quickly than those of younger people, so it's important that they have their eyes examined regularly to keep them seeing as well as possible. But of course, a full eye examination is about much more than providing spectacles. There are many eye problems that might be affecting your residents, some of which are treatable and some of which are not, but all can be detected by our optometrist during the eye examination. This training video will help you understand more about the more common eye diseases and problems, and about their treatment and what you can do to help people in your care who are suffering from these conditions. This is a cross-section of the center of the eye, and we'll be identifying the main parts of the eye as we go through this part of the video. One very common eye problem experienced by the elderly is cataract. Many people think that a cataract is a kind of skin that grows over the eye, but that's not true. Cataract is the name given to an opaque area of the lens of the eye. As we get older, it's very common for the lens in the eye to become cloudy. People with cataract say it's like looking through a fog. This would be the effect of cataract on a resident's eyesight as she approaches the top of the stairs. A flight of stairs can turn into a serious hazard for a person with cataract. Over a quarter of cases of sight loss in people aged over 75 are thought to be due to untreated cataract, which can be successfully treated in over 90% of cases. If left untreated, cataract may eventually result in blindness. Try on the cataract simulator so you can see for yourself the effect of cataract. You may even want to pause the video and try walking around looking through the simulator to get the full effect. Your training manual will give you some more information about cataract, so be sure to read it through at the end of this training session. The treatment for cataract is a small operation during which the hazy lens is removed from the eye and replaced by a plastic implant like this one. In many cases, the patient is then able to manage without spectacles for walking about, needing them only for reading and close work. While a resident is waiting for the operation, you can help them to see a little better by ensuring that the lighting is good and by reminding them to always wear their spectacles. Glaucoma is the name for a group of eye diseases that are characterized by an increase in the pressure of the eye. The most common type is called primary open-angle glaucoma, and this is the condition we're going to talk about now. Between the clear front of the eye, the cornea, and the colored part, the iris, is an area called the anterior chamber. This chamber is full of a fluid called aqueous humor, which is constantly being drained away and replaced. The rate at which new fluid is made matches the rate at which the old fluid drains away, so the pressure remains constant. If, however, something interferes with this balance and either the fluid drains away too slowly or is being made too quickly, the pressure in the eye will rise. This rise in pressure will cause damage to the delicate nerve at the back of the eye, which is responsible for carrying messages from the eye to the brain, and vision will be affected. This condition is called glaucoma, and because the nerve damage happens gradually, the patient is often unaware that there's a problem until much of their field of vision has been lost. In a full eye examination, the optometrist will check the pressure in the patient's eyes with an instrument called a tonometer. At HealthCall Optical Services, we no longer use the instrument that blows a puff of air into the eye. We've replaced this with a new instrument that's so gentle the patients don't even realize that their pressure has been measured. A clinical study has proved that with this new instrument, we can take a reading on people who weren't able to cooperate with the puff of air method because of physical or mental disability. And so there are now very few people who we can't test in this way. Advanced untreated glaucoma will result in a form of tunnel vision, and residents with this condition may not see you approaching from the side. Glaucoma may show no symptoms until it's too late to do anything about it, so early detection is vital, and the best way to ensure this for your residents is again by arranging regular eye examinations by one of our optometrists. Try on the glaucoma simulator to see the effect of glaucoma for yourself. Again, you may want to pause the video and walk about so you can get the full effect. So how can you help residents with glaucoma? Be aware of the difficulties they may experience as a result of their loss of peripheral vision. Assist them when they're walking about and be very sensitive to them when approaching suddenly from either side. More detailed information on glaucoma can be found in your HealthCall Optical Services training manual. Diabetic eye disease is the biggest cause of blindness in the Western world. Diabetes is more common in older people than in the young. Elderly people are more likely to have type 2 diabetes, and as many as 50% of cases may remain undiagnosed. There are currently 1.3 million diagnosed diabetics in England, all of whom are at risk of losing their sight. A regular eye examination will detect any diabetic-related eye problems, and the patient can then be referred for treatment in good time. A patient with advanced diabetic eye disease will have patches of their vision missing, like this. Try on the diabetic retinopathy simulator to see the effect of this condition for yourself. Again, you may want to pause the video to walk about so you can get the full effect. So, how can you help residents who have diabetic eye disease? Well, assist them with any tasks they find difficult, and as with glaucoma, ensure they use good lighting and remind them to always wear their spectacles. Also, do encourage them to have an eye examination once a year. You will be well aware of the effect of a stroke on a person's ability to walk or speak. But did you know that a stroke can also cause a hemianopia, that is, a loss of half of the vision in each eye? As with the tunnel vision of glaucoma, it's important to be aware that if you approach someone with this condition on their affected side, they may not be aware of you until you're right in front of them.
Hello, John. You okay?
Oh, I didn't see you.
Oh, I'm sorry. I got him blindsided.
So, what can you do to help residents with this condition? Make sure you find out if any of your residents who've suffered a stroke have also lost part of their vision and which side is affected. Our optometrist can give you this information.
Oh, brilliant. Do you need
Always approach them from their good side and assist them when they're moving about.
a drink? What would you like to eat? Anything?
No.
And one other thing, it may be worth checking that they're eating all of the food on their plate and not consistently leaving some because they can't see their food clearly. ARMD is a loss of central vision and is a condition that affects mainly elderly people. The macula is the central area of the retina and is the area of the eye that we use to see fine detail. Whenever we look directly at something, we're using the macula. This condition has a profound effect on vision and, in the early stages, often manifests itself with the person beginning to see a bending and distortion of objects such as buildings in the street or items in the home. Eventually, there's a loss of vision in the center of the eye, but with peripheral vision being unaffected. There are two types of ARMD: wet, which can be treated, and the more common dry form, for which unfortunately there is no effective treatment. An elderly person with this condition will usually have the dry form of ARMD, and eventually they will lose their ability to read, watch television, or even see people's faces clearly. Try on the ARMD simulator to see the effect of this condition for yourself, and again, you may want to pause the video whilst you walk about so you can get the full effect of ARMD. So what can you do to help residents with ARMD? Well, once again, in the early stages, good lighting is very important, as is the use of magnification. There is also evidence that diet can play a part in moderating this disease, including the use of appropriate vitamins and mineral supplements. In the later stages of macular degeneration, it will be useful if you can help your residents with reading their letters and completing any forms they have to fill in, and with tasks such as tying their shoelaces. Eventually, the patient will be registered partially sighted or even blind, which, although distressing, does give them some financial and tax benefits. Now we'll show you how we would carry out an eye examination on your residents. The optometrist will need to find out about the patient's medical history and ocular history, what medication he's currently taking, and if he's having any problems with his eyes.
Are you having any problems with your eyes at all?
You can help greatly by providing copies of medication administration records and giving the optometrist any background information you have on that patient.
All right. Thank you, Graham. Now I need to know what you can see without your glasses. So if you can take your glasses off.
The optometrist will first check the patient's vision with and without his spectacles.
Can't see anymore.
Okay.
If you've ever had your own eyes tested, you may remember that at certain points in the test the room was darkened. This is because the optometrist has to look inside the eyes through the small pupil, and any external light can make this very difficult. Something to remember when you're selecting the room for the optometrist to use.
To your left. Good, that all looks fine. Now I need to get an idea of your prescription, so I'm going to put these funny-looking glasses on.
We're often asked how we manage to obtain a prescription for people who are unable to read the chart because of communication difficulties. There are two techniques we can use to do this, and we'll show these to you now. This first technique is called retinoscopy. We can find out what prescription is needed by analyzing the movement of the light that's being shone into the eye. The patient doesn't need to speak or read the chart, and in the hands of an experienced practitioner, it is extremely accurate. The second technique uses an instrument called an autorefractor. This automatically measures the prescription and provides a printout. The autorefractor requires a bit more cooperation from the patient than retinoscopy, and it's not always successful if the pupil is small or there's some cataract. For this reason, our optometrists mainly rely on retinoscopy.
And the other eye.
If the patient is able, they'll be asked to read the letter chart again, and small adjustments can be made to the prescription by asking the patient if different lenses make the letters any clearer.
Does this lens make it look any better, Graham?
Oh yes, it does.
This is just fine-tuning, and an accurate prescription can be provided without this if necessary.
Very smartly worth.
Don't worry that it looks blurred as I...
When the distance prescription has been found, the optometrist will then concentrate on finding out what prescription is needed to allow the patient to read clearly and comfortably.
Satisfying to the eye and to the mind.
And this one?
Now we have reached the trees, the beautiful trees.
Okay, now we need to check the pressure in your eyes.
The pressure in the eyes will also be measured, as a high pressure can be an indication of the presence of glaucoma.
Look straight ahead for me. Right, well there's a small...
The optometrist will record the prescription and will note if any eye disease was detected. She will then hand over to an optical advisor who will help the patient to select a suitable frame and advise him on lenses. If the patient were not able to decide for himself, then you may be able to help him with his selection. We also encourage relatives to be present for both the eye examination and for the choosing of frames. It's very important to know if a patient is eligible for any assistance with the cost of their spectacles. They may even have nothing to pay at all. If there is something to pay, then a quotation will be left for the resident's family or power of attorney, and nothing will be ordered unless all concerned are happy for us to go ahead. A 50% deposit will be required at the time of order. We can also provide spectacle cords for anyone who likes to wear their glasses around their neck. And cleaning fluids and cloths are always available from us, free of charge.
We've seen everybody now. There's a report here for each individual for you to put in their care plan.
When all the residents have had their eyes examined, our optometrist will report to the matron or manager of the home on the condition of each resident's eyes, and a written report will be handed over for inclusion in their individual care plans. This will detail how well they see, what spectacles they need, and any eye disease they might have. It will also indicate when they're due for their next examination.
About cataract, should she ask you any
A summary sheet will be supplied listing the residents who've been seen and what spectacles have been prescribed. At the end of the visit, we may also leave a customer satisfaction questionnaire for completion by the matron or manager of the home. Responses to this questionnaire are carefully studied and allow us to make ongoing improvements and additions to our service.
Yes, on the day. No problem. Well, I can let the families know. And I'll be back to see them all in a year.
Thanks very much for your time.
Thank you.
Thank you. Bye-bye.
You will already be aware of RNIB's talking books. But did you know that they also supply a very wide range of products which can really help your residents overcome the problems they face as a result of their failing eyesight? A good example of this is a speaking clock, which allows residents who would otherwise have difficulty seeing a conventional clock to obtain the time of day without having to ask. Other useful products are big print wall calendars, like this one, and clear large-faced wall clocks, which you could place in community areas for everyone's benefit. And we mustn't forget lighting. Lighting is something we take for granted, but it's amazing what a difference good lighting can make. And alongside lighting, you should also think about color contrast. Using a brightly colored mat like this one under a plate makes the plate stand out from the tablecloth and at the same time offers extra stability. Or when someone asks for a drink, try putting the cup in a colorful cup holder like this one, again providing better contrast and offering extra stability. RNIB also produce a weekly large print newspaper that's so much easier to read by someone with poor sight than a standard newspaper. This newspaper will help them keep up to date and interested in what's going on in the world. And the same applies to their large print TV guide, so much easier to read by residents with poor sight. To find out more about RNIB's products, you can call their customer service team on the number on your screen and ask for copies of their latest product catalogues. Healthcall Optical Services is one of the leading providers of domiciliary eye care in the UK. We operate from a network of local branches and we visit over 80,000 clients each year. And we've been in operation as a company since 1991. We conform fully to the code of practice developed in association with the various optical bodies in the UK. In fact, we assisted in its development. And you may like to know that within our group we also have a sister company, Healthcall Hearing Services, who provide full hearing checks and dispense state-of-the-art digital hearing aids. Further details on our sister company and their UK coverage can be obtained by calling them on the number on your screen. Here we're giving new glasses a final check before releasing them to an optical advisor who will make the appointment to call and fit them. All our glasses are engraved with the resident's name, the date of supply, and either the word DIST for television or constant use, or NEAR for reading or close work. Which of course is a big help to carers such as yourselves when residents pick up the wrong glasses or when they leave them lying around unattended. When using Healthcall Optical Services as your provider of eye care, you can be confident that our optometrists and optical advisors have been carefully selected for their empathy with the elderly and disabled, and that our clinical staff have been vetted by the Criminal Records Bureau and checked under the Protection of Vulnerable Adults scheme. And as part of our continuing development and training, our clinical staff have also obtained the Dementia Care Award of the Alzheimer's Society. When visiting you, our staff will wear a distinctive name badge and carry photographic identification giving their CRB status. We have a nationwide network of optometrists and optical advisors who'll visit you regularly to help you look after the health of your residents' eyes. Completed spectacles will be delivered by trained members of our staff and the frames adjusted to ensure a correct fit.
They're a bit loose, aren't they?
And a final check will be carried out to make sure that your resident is comfortable wearing and using his new spectacles.
Is that nice and clear?
And to help you keep their glasses clean and well serviced, we include in our Optical Awareness pack a lens spray and a cleaning cloth, and a small screwdriver for tackling those tiny screws holding the glasses together. Don't forget that we're always happy to come back and make adjustments to the fit of your resident's spectacles or to carry out repairs. On an ongoing basis, one of the most helpful things that you can do for your residents is to make sure they keep wearing the correct glasses, especially from a safety point of view when they're walking around, so helping to avoid falls and potential fractures. Finally, after your manager has sent us your completed questionnaire, we'll record that you've studied this optical awareness training video by sending you a certificate like this one, made out in your own name. And your home will receive this certificate to display in the home. We hope you found this optical awareness training video useful and that with our training manual, it will help and support you with the ongoing eye care of your residents. Should you have any questions from watching this training video, please enter these on the questionnaire provided and we'll respond as soon as possible. Thank you for taking the time to watch this Health Call Optical Services training video, and we look forward to continuing to work with you into the future. Together, we can make a real difference to the quality of life of your residents.